Good afternoon, everyone. My name is Matt Van Stone, and I'm the Director of Media Relations and Public Affairs here at Geisinger. Thank you for once again joining our weekly COVID-19 press briefing. A few housekeeping items before we start. This briefing is taking place using Skype broadcast in the last 30 minutes. You'll be able to hear us, but we are unable to hear you. Dr. Ryu makes some opening remarks, then we will take questions. Thank you to those who submitted questions in advance. We'll get to some of these following Dr. Ryu's remarks. You can also submit questions anytime during the event using the Q&A panel and Skype broadcast. Please share your name and outlet when submitting a question so we know who's asking. As time allows, we'll take live questions submitted via the Q&A. For those questions we aren't able to answer during the briefing today, our media relations team will respond to you by close of business. Following this briefing, a video recording will be available in the Media Resources Center we have established for journalists. That link will be provided to you before close of business as well. With that, I'm happy to introduce Geisinger's President and CEO, Dr. Jaewon Ryu.
Thank you, Matt, and thank you again to everybody for joining us today. I forget how many of these we've done, but it feels like we are entering a slightly different phase of the pandemic. And as we've talked to you before and mentioned as part of this discussion, we can keep updating you on some of the things that we're doing, some of the data that we're seeing, and how we're thinking about that next phase with some reopening of services and so forth. I think that's what we'll cover today. So let me start with the data as we've been doing in prior weeks. At this point, we've tested over 20,000 patients. So that number continues to go up. And we've seen about 14% of these tests coming back positive. That's roughly in the ballpark of what we've been seeing. It's been hovering between 14 and 17%. And so that's been staying pretty consistent. And then of those who test positive, we see about 17% of them requiring hospitalization, which translates into roughly 500 or so patients that we've admitted at this point. Although the number that's actively in our hospital, COVID positive patients, continues to trend lower. That's a good thing. And so, for example, this morning, I believe, across our entire system, we're seeing in the low 60s as far as number of COVID positive patients sitting in our hospitals today. That's the lowest level we've seen really since early April. And so those signs are clearly very reassuring. What's also very reassuring, because the number of people in the hospital tends to be a lagging indicator, but the leading indicator and what helps us project and predict what will happen over the next week or two is keeping track of how many people are actually testing positive, how many new patients are identified as COVID positive patients. The good news there is we continue to see a downward trend on that as well, which suggests that in the next week or two, we should continue to see decreases in the number of patients in our hospitals as well. A little bit, probably more information than you ever wanted to know about data, but that's what we're seeing. We still see a portion of these patients require ICU level admissions. And of course, folks in the ICU, they have a more involved clinical course, and the amount of time that they spend in the hospital is typically longer than what we see with the other patients. I think the other bit of news that we've been celebrating with you all over the last 3 weeks has been the fact that this also means that a lot of people are making full recoveries and being discharged home. A lot of people are being weaned off ventilators and able to downgrade, so to speak, from the ICU beds to the standard beds inside the hospital. And so a lot of great recoveries, a lot of stories of people being able to go home. And of course, over 85% of those or about 85% of those who are testing positive never require a hospitalization in the first place. So a lot of reassuring signs, I think, from the data standpoint. But at the same time, as we've done previously, I think it's more important now than ever that we don't let up on all of the preventive measures and the precautionary measures, whether that's social distancing, avoiding large gatherings, hand hygiene, masking and screening, and all of those things that we've talked about before, especially as segments of society and segments of our services continue to slowly phase back in. we know that it's even more important now than ever before to pay attention to those guidelines and follow those precautions. And so we've been emphasizing that, and we've been trying to get out and about in our communities to take that message. And it's one of education, and it's one of trying to be helpful, bringing this kind of factual information to those that really need it, where we think we can make a difference. A good example of that is with our local nursing home partners. We don't own and operate these facilities, but we know that the more we can do along the lines of prevention in those settings, we know that that helps the entire community as well as our hospitals. Another great example is some of the town halls and discussions we've been having with local employers as they're easing back into their businesses. They have a lot of questions around, should they be screening everybody? How should they be screening? Should they rearrange shifts? Should they rearrange or stagger lunch breaks? Should they limit how many people are in their buildings? And we've been able to take our employee health team and serve as really counsel and advisor in those roles. And we've also put together a toolkit for a lot of small businesses. And we recently had a virtual town hall coordinated by over 12 different chambers of commerce along these same lines. So these are the kinds of things that I think really suggest we're into this slightly different phase of the disease and the pandemic, where now we're paying attention to how to reopen. And along those lines, as we updated you all last week, here at Geisinger, we've been slowly easing back in different services. As you all know, early on in the pandemic, we had postponed or canceled a lot of our elective procedures and non-urgent clinic visits. Of course, the urgent things, the things that were still clinically urgent, we've been doing those all along. But the things that were not as urgent, we've been postponing them. And then about a week and a half or 2 weeks ago, we started reintroducing those services. And as we do so, we've been exercising all of those precautionary steps that we've been talking about, and then some. I think it's a good reminder for everybody that every person who steps foot on our campus, masking is absolutely required. And so is screening at the front door. So if you walk on any of our campuses, you will get your temperature checked. You will be asked a series of questions. You will be expected to wear a mask throughout the entirety of your time on our campus and in our facilities. And that really is for the safety of everybody. It's not just for the safety of that person. It's for the safety of our staff. It's for the safety of the other patients, and for the safety of others who may find themselves in our facilities and on our campuses. Just this past week, actually, we had sent out cloth masks to all of our employees so that they could use them out and about in their personal lives, not even related to work. If they're out in the community, out at the grocery store, anywhere else that they're going, so that they have a mask. And then, of course, for patient-facing areas of our facilities, there are different levels of masks that people are trained and expected to wear. But this whole notion of masking, I think it's something that's going to be with us for a while, as this virus we know is prevalent out there in the community. So that's a little bit about how we're reopening. I know that we get a lot of questions from patients that have had procedures or care needs that have been put off during this time. We are super thrilled to be able to reintroduce those things. And of course, each and every one of our providers, our physicians and the care teams are working closely, staying in tight communication with those patients and trying to make sure those things get scheduled pretty quickly. Another thing that I want to remind everybody on, we mentioned it a little bit last week, I think it's worth re-emphasizing all of the steps that we're taking to keep our facilities safe, especially as we get gradually more activity coming back into those environments. We want to make sure everybody understands that whether it's separating all the areas where the COVID patients are being treated, those staff in those units don't cross over into other areas. And by doing that, we maintain that separation. We know that promotes safety. I mentioned the screening and the masking of everybody. By doing that, we know that we're limiting the exposure and the spread of the disease, and that promotes safety. We also know that whatever visits can be addressed through telemedicine and other means, we're doing a whole lot more of that, and we know that that promotes safety. In our clinics, we are staggering the appointment schedules to try to space them out further across the day. We're also working on how our waiting rooms are configured, and in fact, by and large, greeting patients, rooming them immediately so that the time in the waiting room is limited to a bare minimum, if anything at all. That promotes safety. So there are a lot of these steps that we're taking. Obviously, our environmental services team with the cleaning, whether it's in the ORs or in the clinics, things that we were always doing, but now doing them to an extra degree of diligence above and beyond what we typically do. I think that also promotes safety. So there are a lot of things to make sure that our facilities, our campuses are as safe now as ever before, and believe it or not, probably even safer. So we want to make sure that everybody understands that as they continue to have their care needs, because we're also hearing cases of folks postponing necessary care, and that creates downstream complications in their clinical course, which of course is not what's best for their health either. So wanted folks to understand that. And then as far as society reopening, I think it's worth underscoring the things that we've always been emphasizing. As society reopens segments of activity, I think it's important to remember the 5 things that we've always emphasized, and I'm going to read them off to you as I've done before. Stay home if at all possible. Wash your hands. I think the remarkable thing about this virus is that something as simple as hand hygiene, washing your hands with soap and water, and if that isn't available, the alcohol-based hand sanitizers, that simple step goes a long way in terms of prevention. Try not to touch your face, keep the surfaces clean, and give back and check in on your neighbors, friends, and families if at all possible and whenever you can. So I'm going to pause there and turn it back over to you, Matt, and we can hit some of the questions.
Thank you, Dr. Ryu. WKOK Radio and the Clinton County Record had questions about vaccines. In your opinion, is anyone leading the vaccine race right now? And what do you see as a realistic timeline to have a vaccine that can be widely distributed in the U.S.?
Yeah, so I think folks probably have read about, there are over 100 different vaccine development initiatives going on across the country. That's a good thing. That means that there's a pretty good likelihood, hopefully, that at least one, if not several, would be my guess, would emerge with a vaccine that's effective. We don't know the exact count. We don't know who stands to win in that race, as the question alluded to, but I think the idea is that there will be a meaningful vaccine. Exactly when, I think that's a little bit of a guessing game, because all of the vaccines are going through the appropriate channels to ensure safety and efficacy, meaning they have to be safe to use and they have to be effective against the virus. Otherwise, it doesn't make sense to use them. And there's a very scientific process around these clinical trials to evaluate that. As I've said before, I've used the term, whether it's medications or vaccines, the research is important to understand for sure whether something is lucky versus good, because we want the things that are good, because if they're lucky, they may not stay lucky. And so I think that's going to be important. We're obviously keeping our eyes closely on it. Some of the estimates I've read is anything between towards the tail end of this year into sometime in next year that we would hopefully have a vaccine. I think the other thing that's important to remember with any vaccine that we even currently have, it's never just a single supplier. You know, whether it's the flu vaccine or varicella, the chickenpox vaccine, or any host of others, there are several or a handful of manufacturers that make those products. And so I would expect something similar with the COVID vaccine eventually, that there would be a handful out of these 100 or more efforts that are developing vaccines that would hopefully work, you know, as we're going through the next waves or phases of the virus.
From the press enterprise, are you still using hydroxychloroquine on any patients, and how effective has it been?
Yeah, so this actually came up in a discussion this morning with some of our local elected officials as well. So I know it's something that a lot of folks are curious about. I think it's important to understand that a lot of these treatments are still experimental, and that includes hydroxychloroquine. That's why there are, you know, clinical trials evaluating whether it's actually effective, and if so, for which particular populations and for which phase of a disease course. And so those things are more unknown than known at this point. I think what is absolutely known and became known to the point that the FDA acted on changing its guidance several weeks ago is that one of the side effects of hydroxychloroquine, it has been linked to cardiac or heart arrhythmias, which could actually cause death. And so given information like that, obviously it's not something you'd want to take unless you have the right kind of guidance and precautions and so forth. For us, we have limited it to the use inside the hospital where patients are monitored anyway. And so if they had a heart arrhythmia or any symptoms along those lines, we would be able to intervene and act quickly. And even within that population, we think it's really more appropriate for certain segments than others. And so we've developed care protocols that accommodate those kind of things. As the evidence is more known, as it becomes more definitively proven whether it's effective or not, obviously we would incorporate and make those changes to our care protocols as that time is there. But I think the key punchline here is it's an unproven drug. It does have dangerous side effects. It's not something to be taken lightly. And if you use it, we think the appropriate setting is inside the hospital.
And from WKOK Radio, is Geisinger planning to do anything to proactively assist nursing homes and long-term care facilities to prevent future outbreaks?
Yeah, so this is an area that I think we've been at now for, gosh, over a month, and we've periodically updated all of you. We know that when there's an outbreak or a hotspot in a nursing home, or whether it's a meat packing plant or a Amazon warehouse or wherever you have these outbreaks, we know that that can impact the community pretty quickly. A local flare in a nursing home can turn into a broader outbreak within the community surrounding it. And so we've also recognized that although none of these facilities are owned or operated by us, we recognize that their problem very quickly becomes our problem. And I think it's a good reminder of what we've said all along, that we're all in this together, everybody in the community. And so given those things, what we've done is we've actually gone upstream with nursing homes where we have these relationships, because we're always coordinating care with them. Some of our employed physicians serve as medical directors at some of these places. We've been able to meet with them around the proper use of PPE, how to promote some separation in that environment. And most importantly, what we've done more recently is around testing. The appropriate patients, as they're getting discharged back to those environments, we want to make sure the testing is there. And with that knowledge, they're able to take the right precautions. And so there's a whole slew of efforts. I've probably scratched the surface on this one. But the short answer is yes, we're doing an awful lot in the nursing homes, and appropriately so, because we know that that's one of these hotbeds of activity for corona.
From the press enterprise, as businesses reopen, what are the most important steps they can take to keep their patrons safe?
Yeah, so I alluded to this one a little bit. We had with over a dozen different chambers of commerce, we had a virtual town hall. Oh boy, it was probably 2 weeks ago or so, and we had numerous employers from around the area. And of course, many of these employers don't have their own employee health department the way that we do. And so they had a lot of questions around what can they do as they reopen functions of what their businesses are. How can they keep their customers? How can they keep their employees safe? And what we've told them is we've developed a toolkit, and we've actually taken that out and offered it up to any employer who wants it. And it includes things like, how do you manage flow of foot traffic through your facility, whether it's a manufacturing plant or whether it's a retail shop? How do you do those things? Exits in one place, entrances in another. How do you put visual cues on the ground, whether it's stickers or otherwise, to make sure people are spacing out by 6 feet or more? Maybe it means you have to stagger the work hours so that fewer people are in the building at any given moment. You may need to stagger lunch breaks throughout the course of the day so that fewer people are in the cafeteria. We've even gotten quite a bit of questions around the use of public bathrooms on those work sites, and how do you properly sanitize them more frequently so that you're reducing the risk of spread of the virus. And so there's an awful lot of information that's in these toolkits, but also our employee health team has been out and about meeting with some of these employers to try to get them the kind of information that I think they're all craving for.
From WKOK again, the CDC this week has said that COVID-19 is much more likely to be transmitted person to person rather than by touching surfaces. Do you anticipate that wearing a mask when you cannot social distance is here to stay?
Well, I'll take the second one first. I think wearing a mask is absolutely here to stay. And it needs to be here to stay because at least until we have a meaningful vaccine, and I mentioned earlier, on all of our campuses, mandatory masking is in place for everybody. And I don't know how many of you all saw, but I just took my mask off just so that my voice isn't muffled. But you know, we have masking here as well, and it's a very important step. I think the masking is here to stay. As far as the first question around, remind me, Matt, what was that? The first part of the question.
It was just about the CDC saying it's...
the surfaces, that's right. So this came out recently, and that's absolutely right. And you'll remember there were some studies in the previous weeks that showed that the virus or fragments of the virus could survive on surfaces, whether it's plastics or wood or what have you, for sometimes as long as 72 hours. And so I think there was a lot of public concern, understandably, that you can get the virus by touching these surfaces and then touching your face. I think theoretically that's possible, and it still remains to be seen whether the virus that's left on these surfaces are fragments that are dead virus or whether it's actual live virus. But I think the CDC's revised recommendations suggest that the risk of transmission through those kinds of means is still on the lower side. I think the higher risk is person-to-person transmission because you're within a close enough distance of somebody. They're breathing, obviously. They may or may not be talking. They might sneeze, they might cough, and so forth. I think those types of interactions carry with it a significantly higher risk. And I think that's what the question is getting at. Earlier this morning, I got asked that same question, and what I said was, and I think this is what our infectious disease folks would say, surfaces that have high traffic, where many people are touching them throughout the day, I think that is still a significant risk for transmission of the virus. Probably more so than a surface that gets touched once and then 2 days later someone might touch it again. And so things like doorknobs, I think this is also where the public bathrooms and the faucets and so forth, higher risk environments there. But it's why we stress that the 5 things that we've been stressing, whether it's the hand hygiene, the screening, the masking, the distancing, all of those things are intended to be protective against those various modes of transmission.
The Hazleton Standard speaker in the press enterprise asked about layoffs. Have there been any layoffs necessary, and any idea how many workers have taken advantage of the worker assistance program?
Yeah, so we, I think we discussed the last couple times that we initially kept everybody whole through April 25th or 6th, and then since then we've had a combination of people being able to draw into their banked PTO hours or their vacation, borrow against future vacation, draw from donated vacation from others, or unpaid leave. And so there's a combination of those things that have been at work since then. And of course, what we've been focused on is at this point, we've reassigned close to 2,000 people. And the more we're able to reassign people from areas of lower or less activity to areas of more activity, you know, we're able to keep folks working and busy because we know that there's still a lot of work to do. Now, not everybody can be reassigned, and that's where those other levers come into play. And the strange thing now is as we enter this new phase and reintroduce some of those services, a lot of the folks that we had reassigned in one place, now they're getting reassigned back to their home base environments, and so we're in the process of doing that. At the same time, I think it's a good point to mention that we have been pretty transparent that the impact of COVID financially is profound, not just on Geisinger, but throughout the industry. And so the ripple effects for all healthcare organizations financially from COVID is significant. I think you all are reading about that in the news. It's no different for Geisinger. We have said that early on we estimated that every month the negative financial impact of COVID was something on the order of $100 million negative every month. Based on our more recent experience, it may even be a little bit more than that, to be honest. Obviously, we're super grateful for the efforts and assistance from the federal and state governments, but we know that that will only offset a portion of those losses, and the financial losses will be profound. I think that's the punchline of the industry right now, and that's why you see a lot of folks trying to manage how do you manage and deploy your workforce in a way that makes sense. And that's the background or context behind some of the steps that we've taken and we've been updating folks about.
Fox 56, WNEP, and the Press Enterprise all asked about pediatric inflammatory syndrome affecting patients at Geisinger. How has Geisinger had any of these cases, and what preparations can be made in case we do start to see it, and what precautions should parents take?
Yeah, so we have seen our first case, and I think that was only a matter of time, given if other markets are seeing it, that means it's part of the disease. And so we have seen our first case. I think we're very fortunate in this regard that we have our own children's hospital right here in Danville, which has our own pediatric subspecialists. And that's a great position to be in because these are complicated issues, obviously, with a very serious disease course. But my understanding is we have one case in the house, and our team of experts is rapidly working for the betterment of the health of that person. So we'll keep you all apprised, but that's how it stands, at least as of today.
And what precautions should parents take?
I think it's being vigilant. It's paying attention and really having your antenna up on what your child may be going through, and paying attention to symptoms. If there's any concern, obviously, bring them in to be evaluated and potentially tested. We do have a COVID hotline that's 24/7 as well that can offer a lot of clinical advice and counsel. And of course, contacting your primary care is another move if you have any concerns. And in the meantime, if you don't have those concerns, it's emphasizing those same precautionary preventive measures.
Looks like we have time for one more from WNEP. Is Geisinger doing antibody testing? And if so, what is the procedure for patients to get those tests?
So the antibody testing question has continued to be sort of in the all-time favorite list. And I think the short answer, and we've talked about this before, antibody testing, about a month ago, we would have said that the accuracy of the tests weren't quite ready for prime time. I think now the accuracy is ready for prime time, but it's important to understand what those tests test for, and more importantly, what they don't tell you. So they will tell you if you've been exposed to the virus or not, because they'll measure if you have antibodies or not. What it won't tell you yet, and I think the science is still evolving on this, it won't tell you whether you have the right antibodies or if you have enough of the antibodies to actually confer any immunity. And so that's still a place where the science has a gap. We do think that over the coming weeks, the science will continue to evolve very quickly as it has, and maybe it'll be able to answer that question. Thus far, not yet. But there's still utility in the test for things like evaluating someone to be a potential donor of convalescent serum, or to track the disease prevalence rate in the community. So from an epidemiologic standpoint, there's a value in knowing how many people have been exposed. But for a person to know whether or not they're immune, the testing isn't there yet. I think what our plan is we anticipate the science to continue to evolve. We do anticipate in the coming weeks ahead that we would be introducing the antibody testing with the right education to folks about what it tells you and what it doesn't tell you. And we'll probably do that in a phased way, going category by category of people where we think there may be some value in doing it. So stay tuned, more to come, but I think this is a quickly evolving space.
Thank you, Dr. Ryu. That concludes the briefing for today. Thank you for everyone for joining. If we didn't get to any of your questions, a member of our team will get back by the end of the day today. Hope everyone enjoys a nice long holiday weekend.
Thank you, Matt.